The mining sector has reported that it has so far recorded just close to 28,000 COVID-19 positive cases amongst mine workers. The virus has claimed the lives of just over 300 workers in the industry. The Minerals Council says most positive cases were in the platinum sector in the Northwest Province. Active positive cases in the sector at present stand at just over 1,000. Well, to talk about COVID-19 on the mining sector, we're joined now by Dr. Thuthula Balfour, the head of health at the Minerals Council. Thank you so much for joining us, Thuthula. Now, just describe to us the kind of impact that the pandemic has had on the industry and operations.
Good afternoon. Thank you. The industry, of course, has had a major impact, in terms of how we work and even our output. If you look at the statistics, the amount of ore that has been produced, or the production, it has gone down, although it was cushioned by the better commodity prices. And so the industry did not suffer as much as it would have if the prices were low. Again, it has had an impact on our employees. COVID-19 is a very aggressive disease in terms of the uncertainty it causes, the death, that it causes both for employees and for their families. And so there is a lot of anxiety and mental stress which is caused by the epidemic. And in fact, we now are looking out for the impact that might have on safety, because people sometimes now are so not mindful because of the extra stress they have from COVID-19 and its impact on themselves and their families, that people are not very careful at work, and therefore you have accidents which are due to that fact. So it really has had an impact. And we are trying to manage all of those impacts that the epidemic has had.
Now, how have the holiday season and people travelling across different provinces and borders, how has that impacted on the infection rate recorded in the industry?
What has happened is what was expected, mainly because, disease travels, infectious diseases travel with people. So the more economic activity, the more movement there is of people, the more the virus or whatever disease will, disseminate. So before we closed, we were already in the second wave in the coastal regions, that is Western Cape, Eastern Cape, KZN. And we are those are our labor sending areas. And so we knew that people are going to have to go home and then come back. And coming back would have meant that they have been to hotspots and are likely to have, contracted the virus. And so we did put in place measures such as for the workers that were going across the border, PCR tests were organized for them because they required those for them to cross the border. And then some companies did try to dissuade workers maybe from going away for the festive season to those areas, just so that they are not affected. But of course, it's natural. People would want to go home, which of course, quite a number did go home, which is why then when people did come back, we had measures in place to try and reduce the rate of transmission, which we knew would be high. So a lot of companies put in a lot of testing of workers, especially those from hotspots, because even our guideline from the DMRE does state that, you need to have extra measures for people from hotspots. And that's part of the reason that we picked up so many cases in January when people were coming back. And but that then meant that you can isolate those who are positive and at least reduce the number of people that will go into the workplace and continue to infect others.
Right. So as the vaccination phases roll on, what is the industry's plan in terms of vaccinating workers? And will there also be a plan around vaccinating community members as well? Because I know that many of the mines do have clinics dotted around the communities.
The mining industry is part of BUSA, And at Busa, we have got Before SA, which is leading government support, on the vaccine initiative. And so business is fully with government. Government is leading the initiative, and we are fully supporting them in ensuring that as many people who need to be vaccinated are vaccinated. So even the companies, mining companies, have committed to that, which means that already, we've registered our health workers, and we are in the process of registering all of our vaccination sites, and we'll be ready to participate as vaccination sites for phase 1, health workers, for phase 2, which the mine workers will fall into, and the rest, which is phase 3. Companies might not be the same. Some will be able to reach out further than others in terms of the communities surrounding them. But the general approach is that we, as the industry, try to assist government as far as possible so that we collaborate with them in the mining areas for the vaccination of the communities which are there.
Thank you very much for your time there. That's Dr. Thuthula Balfour, the Head of Health at the Minerals Council of South Africa.